will be on levels of prevention. So before going into the details of the levels of prevention, what exactly is a preventive dentistry? Though there are different definitions, must be referred preventive dentistry as a science of the care that is required to prevent the diseases of the teeth and supporting structures. It is not only about teeth, it is about the supporting structures that includes periodontium, that includes malocclusion, that includes oral cancer, that includes trauma. So how you prevent dental caries, how you prevent trauma, dental trauma, how you prevent malocclusion, everything will be taught for you in this course. So Livia and Clark has defined it as an interception of the disease process. Interception means intervening the disease process, stopping the disease process in between and preventing it at that level of the disease by providing adequate treatment. Now, what are the principles of preventive dentistry? Basically, as I had mentioned earlier, it encompasses all aspects of preventive dentistry. Whether it is in malocclusion, preventive dentistry comes there. Whether it is in trauma, preventive dentistry comes there. There are various strategies to prevent dental trauma. There are various strategies to prevent dental caries. There are various strategies to prevent periodontal disease. There are various preventive strategies to prevent oral cancer. So basically, it encompasses, that means it covers all aspects of dentistry that focuses on the procedures and life practices. What are the practices that needs to be adapted to help an individual or the community in preventing the disease or preventing the progression of the disease. This is all about the preventive dentistry. So the preventive dentistry has certain principles that includes controlling the disease. Disease control is the first principle, followed by patient education and motivation. Without patient education and patient motivation, the ultimate goal of preventing the disease cannot be achieved. So this plays a significant role. Apart from that, you can improve the improve the host resistance, develop the host resistance, restoration of the function, as well as maintenance of the oral health. These are considered as the principles of preventive dentistry. Now, before going into the details of the levels of prevention, you first have to know what is epidemiological triad. Epidemiological triad is the simplest model, okay, that explains how a disease occurs. For a disease to occur, three things are required. One is host, the other one is agent, the other one is environment. Basically, this is a traditional model that explains how an infectious disease occurs. It consists of an external agent, a susceptible host, and an environment that brings agent and host together. For example, if you talk about dental caries, what are the host factors? Host factors means as an individual, as a patient, what are the factors that in the patient can cause disease or can affect the balance so that the disease occur. That includes, like for example, if you talk about dental caries, it can be a tooth enamel structure, the integrity of the enamel, the amount of salivary flow, the quality of saliva, the immune response of the individual. These all are host factors. That means what are the agent factors then? Agent factors includes microorganisms such as Streptococcus mutans, lactobacillus, other microorganisms. These are called as agent that causes disease. Okay. Then what is the environment? Environment includes like fluoride availability, amount of fluoride available, the patient consumes fluoride, the nutrition, diet, socioeconomic factors of the individual, and apart from that, the plaque, the mouth, the quality of the plaque, the quantity of the plaque, all these are called as environment factors. There need to be a balance maintained. Whenever the balance is disturbed among these three, the disease progresses. Apart from that, secondary factors such as age, nutrition, and food also is found to influence the initiation of the disease as well as progression of the disease. So the Livell and Clark has classified the levels of prevention into three categories. One is primary, the other one is secondary, the other one is tertiary. Under primary prevention, there are three categories. One is primordial prevention, health promotion, as well as specific protection. The secondary prevention includes early diagnosis and prompt treatment. That means the disease has occurred, you have diagnosed it, but the initial stage you treat the disease. Primary prevention, the disease is not yet occurred. You prevent it before the disease occurs. That is primary prevention. Tertiary prevention is that the disease has occurred and considerable damage has been done. You stop the disease at a later level to prevent further damage to the tissues. So this is all about the levels of prevention. Now, to begin with primary prevention, what exactly is primary prevention? I told you the word primary. Primary means at the beginning. The all action that is taken before the onset of the disease. Before the disease occurs, whatever preventive measures you take so that the disease should not occur, that is called as primary prevention. This is also referred to as pre-pathogenic period. Okay, all actions that is taken in the pre-pathogenic period, those are called as primary prevention. Like for example, before the caries occurs, for example, first permanent molar erupts at 6 years of age. Okay, when the first permanent molar erupts, it will be more for caries because still the enamel is in the maturation stage. At that age, you apply fluoride, you make the enamel stronger. Once the enamel is stronger, it is more resistant to caries. So before the disease occurs, whatever procedures you do, those are called as primary prevention. This primary prevention has three subcategories that includes primordial prevention, health promotion, and specific protective measures. Now, what is this primordial prevention? Primordial prevention is the primary prevention in its purest form. This is considered to be as a purest form of primary prevention. Here what you do is that very at the basic level, much earlier than the disease occur, you change the behavior of the patient to maintain a healthy lifestyle. Like for example, you encourage the children to avoid junk foods, to avoid abnormal eating patterns, to stop abnormal pernicious habits, so that what happens is the child maintains body as well as oral cavity. If the child is more prone for abnormal junk food eating, there will be excessive childhood obesity that can further lead to not only dental diseases but other systemic diseases. So preventing at the basic level, at the behavior of the individual, changing the pattern of their lifestyle so that they can lead a healthy lifestyle both and maintain a healthy oral cavity, those are called as primordial prevention. Now next aspect of primary prevention is health promotion. Health promotion, according to World Health Organization, it is a process of enabling or making individuals to improve their health through their personal choice and social responsibility. That means what example you can say it as a diet planning. See, I am obese, I want to reduce, or I have more of caries, I have to stop eating sugary foods, I have to make a regular dental checkup. So these things, what up they promote their health through social responsibility and their personal choice. This includes prenatal and postnatal counseling, nutrition, public health education, as well as periodic screening. Periodic screening means every 6 months, whether I have caries or not, I visit the dentist every 6 months so that if any caries occurs, it can be prevented at a much early stage. So these are considered to be as an health promotion activities. Next is specific protection. Specific protection means the word itself says specific. Specific means it protects only particular disease. Okay, like for example, you give vaccines, isn't it? For vaccine, for if you give a COVID vaccine, it is protects only COVID, specific protection. If you give a measles vaccine, it protects particular disease only. These are called as specific protection. Even this comes under primary prevention. If you talk about the dentistry aspect, you can talk about fluoridation. It can be a water fluoridation. They add fluoride in the water so that whenever you drink water regularly, the fluoride gets topically deposited and makes the enamel more stronger and resistant to dental caries. Application of topical fluorides. Okay, topical fluorides can be self-applied by yourself and it can be applied at the professional level at the dental clinics. Topical fluorides protect dental caries. Sealant application, Pitt and Fisher sealants. These are called as sealants. Can you see here? These are called as sealant, Pitt and Fisher sealants. So these are applied especially for the molars and the premolars to protect them from dental caries. So they protect only dental caries. They do not protect periodontal disease. Understood? That is why it is called as specific protection. Preventive orthodontics you can use, and apart from that, preventive orthodontics includes like space maintenance. When a primary tooth is lost, you give a appliance to maintain that space so that the permanent tooth erupts in that space properly. So you prevent the malocclusion. That also comes under specific protection. Wearing seat belts whenever you are in a car, you wear a seat belt. Why you wear a seat belt? To avoid injury when you met with an accident or anything like that. And using mouth guards, especially in contact sports like boxing, in that conditions, using mouth guards protects the teeth from trauma. So these are called as specific protection. So what are the various preventive procedures that can be provided in an office for a child or any individual for that matter? So basically you can provide various preventive procedures. These are the few one that is listed here, that includes prenatal and postnatal counseling. What is this prenatal and postnatal? Prenatal means when a mother is pregnant and she visits the dentist, you have to educate the mother to maintain her oral hygiene as well as to maintain the child's oral hygiene once it is born. So that what happens is, because there is evidence that the whatever the streptococcus mutants that the mother is possessing, that can be transmitted to the child. So mother has to maintain a healthy oral hygiene, especially when she is pregnant. So, and she has to maintain the oral hygiene of the child when the child is born. So prenatal is before the child is born, that what counseling you give to the mother, and postnatal counseling is after the child is born, what instructions you give to the mother to maintain her oral hygiene as well as the child's oral hygiene. These are this is also a form of preventive dentistry part. Then apart from that, early screening, diagnosis and treatment are an essential part of preventive dentistry. You can use some disclosing agents. These are some chemicals that are applied over the tooth. Okay, disclosing agents. So what they do is that they expose the plaque that is present. Okay, so plaque not always can be seen by the naked eye. So sometimes what you have to do is you have to use certain disclosing agents. When you ask the patient to rinse this and then you see that there is plaque, you clean those areas wherever there is discolored area, there is plaque areas, so that it will be more clear for you to complete removal of the plaque. So toothbrushing instructions is a part of preventive dentistry. Then giving various instructions how to use the dental floss. Then motivating the child and the parents in maintaining a healthy diet habit so that they don't suffer from dental caries or other dental diseases. Giving fluoride supplements, especially in areas where there is no, in that area, giving fluoride supplements will be very much beneficial for the patients. Giving topical fluoride treatment. Topical fluoride treatment means fluoride is mainly used to prevent dental caries. I told you earlier. So topical fluoride means it can be self-applied, it can be professional applied. Self-applied means whatever toothpaste you use that contains fluoride, that is self-applied topical fluoride. If you come to clinic, okay, in the patient you can apply fluoride for children in the clinic. Like it can be applied in form of fluoride gel, it can be applied in the form of a solution, or it can be applied in the form of a varnish. Okay, you can paint it with a brush. So fluoride, topical fluorides protect the tooth from caries. More often, it is very effective when the tooth is recently erupted. So it is more efficient to prevent caries, especially in children. You can use fluoride rinses. Apart from that, occlusal sealants, I told you, Pitt and Fisher sealants, for protecting the molars and the premolars from caries. Space analysis, that means when a primary tooth is lost, you give a device to maintain the tooth, appliance to maintain the tooth space, so that the permanent tooth erupts properly into the space without causing any malocclusion. And periodic recall. These are some of the most commonly followed preventive protocols in the clinical setup. Once you come to level 9 in pediatric dentistry and level 12, you do all these procedures in the patients. So you will have a better idea of the, especially in relation to children. What are the other thing is that first dental visit. Okay, according to the American Academy of Pediatrics, a child should visit the dentist within 6 months of the eruption of the first tooth. Generally, the first primary tooth erupts at 6 months of age. As soon as the tooth erupts, if they visit, that is very much recommended. If not, not more than 6 months. That means from the eruption of the first primary tooth. That means not more than 12 months of age. First primary tooth erupts at 6 months. Maximum plus 6 months is 12 months, not later than that. So that what happens is whatever the instructions you give to the nursing mother, how to clean the tooth, how to maintain the healthy teeth is very essential when you are giving it prior to the eruption of the primary tooth. So this is very essential. The first dental visit should not be later than 1 year of age of the child. The preventive philosophy should not be just confined to the office setup. It should be there even in the community level, like doing community water fluoridation. That means, for example, whatever the fluoride for whatever the community water supply is there. That means the municipality water supply that is given to the people there, you should assess the fluoride level. If there is less fluoride, you add fluoride to the central water supply so that everybody gets adequate amount of fluoride, and that protects the individual from dental caries. Apart from that, the other preventive aspect is that school dental health program. School dental health program is a very efficient and effective program where you give preventive dental services like water fluoridation, fluoride mouth rinse, fluoride supplements, as well as pit and fissure sealant. And you do apply topical fluorides, as I had mentioned earlier, fluoride gel, fluoride varnish you can apply in the school dental health program. Once you come to level 11, that is there you have a program course called as dental public health. Okay, in that program, in that course, you will be taken to schools where you have to do preventive procedures like apply pit and fissure sealant for the children, do topical fluoride applications such as fluoride varnish, APF gel application, fluoride application. Apart from that, you have to educate the child, you have to motivate the child, you have to give oral health education for the child to maintain a healthy oral cavity. So these are some of the preventive practices that is commonly followed, and these are the different levels of prevention. Now, next is secondary prevention. We have spoken till now about the primary prevention. Now it is about the secondary prevention. Secondary prevention means what the word says secondary. Primary means I told you before the disease occurs. Secondary means the disease has started and it is in incipient stage. Sorry, incipient stage. That means at the beginning stage. Okay. So what you do is that you diagnose it at an early stage and do the adequate treatment. Like for example, proximal caries. Proximal caries is not routinely diagnosed clinically. If it is clinically, sometimes proximal caries cannot be seen clinically. When you take a routine radiograph, you see a proximal caries. So once you see a proximal caries and it is at the beginning level, that time what you do is that you do a restoration so that it does not further progress and lead to a pulpal inflammation. So this is called as secondary prevention. It is implemented in early period of pathogenesis. Early period, that means at the beginning stage. Pathogenesis means what? How a disease progresses. How a disease progresses, that is called as pathogenesis. So at the early period of disease progression, you stop the disease and you do a adequate restoration of the function of the disease. So this is called as secondary prevention. This includes mainly early diagnosis and prompt treatment. What all it includes? It includes like periodic detailed oral examination along with radiographs, as I told. Prompt treatment of incipient carious lesions with preventive resin restoration. For example, a child comes to you, a 10-year-old child comes to you, he has a first permanent molar, in that only the central pit is caries. Okay, first permanent molar, central pit is caries. What you do is that you do the restoration only in the central pit, and the remaining area you give a sealant. Remaining fissures you give a sealant, so that what happens is you have done the restoration also, you have protected the remaining areas of the tooth. So this is called as preventive resin restoration, PRR. Any developmental defect like enamel hypoplasia or any hypomineralization is there, you give adequate importance to that and restore it then and there itself, that is also comes under secondary prevention. Interceptive orthodontics. That means what? For example, a child is having a thumb sucking habit like this. Okay, the child is 8 years old and still is having a thumb sucking habit, or a child is 9 years old and is having a mouth breathing habit. In that condition, what you do is you give an appliance. Okay, because if you leave it like this, it will lead to a proclined anteriors and definite malocclusion. So you have to intercept it. That means you have to intervene it and stop the habit and protect the remaining dental structures so that it does not further aggravate into a severe full-blown malocclusion. So these are some of the examples of the secondary prevention. Next is tertiary prevention. Tertiary prevention is, the word itself says tertiary. Primary is finished, secondary is finished, tertiary. That means it is middle and late pathogenic period. Like for example, the caries has occurred, it is crossed the enamel, it is crossed the dentine, and it is very close to pulp. Okay, in that condition, you call it as a tertiary prevention. It includes two aspects. One is disability limitation and rehabilitation. What is this disability limitation? That means, for example, the caries has reached, involved the enamel, dentine, and is very close to pulp. You have to do a pulp capping. That comes under disability limitation. If you don't do that, it will go into involve the pulp, and there will be development of abscess and other cellulitis and other issues. So for that reason, to protect that, you do a pulp capping at an earlier stage before it involves the pulp. In case if it involves the pulp, you go for root canal treatment, because failing to do a root canal treatment again leads to abscess and other cellulitis, osteomyelitis, other conditions. In case it cannot be done RCT, you have to go for extraction. If you don't extract, again it will cause further problems like cellulitis and osteomyelitis. And in some conditions, orthodontic treatment, established orthodontic treatment. Okay, for example, the skeletal malocclusion is there. Okay, so it is full-blown malocclusion cases where you go for fixed orthodontic treatment. Okay, you give wires, use fixed orthodontic treatment. It's called as taquim. So those all things comes under tertiary prevention. What is rehabilitation? Now, for example, because of caries involving the pulp, there was an abscess, and the tooth was not suitable for root canal treatment. You have done an extraction, for example, or because of trauma, the front tooth is lost. Okay, so what happens is you have to replace the tooth. Okay, that is called as rehabilitation. Rehabilitation means what? Restore the lost part and restore the function also. Okay, like replacement of lost tooth structures. For example, a tooth is trauma. It can be an anterior tooth or a posterior tooth. You replace a tooth with a prosthesis. Okay, appropriate appliances like dentures, bridges, etc. Why you have to do that? You have to restore the function, harmony, as well as aesthetics. So this process is called as rehabilitation. For example, if a child has lost an anterior tooth, okay, so you have to give an denture, partial denture, or an implant only for the particular tooth. You are rehabilitating. That means you are restoring the function, the aesthetics, and so that the patient's aesthetics and the function is restored. Okay, this process is called as rehabilitation. This is all about the levels of prevention. We have spoken about the primary prevention. Under primary prevention, we spoke about primordial prevention, specific protection, and health promotion. Then we spoke about secondary prevention. I have given examples for that, and tertiary prevention. Under tertiary prevention, we spoke about disability limitation and rehabilitation. Now, next, coming to the preventive programs for oral and dental diseases. For every disease, there are different strategies that needs to be followed, and all these topics will be covered for you in the later part of the course. It includes prevention of dental caries, various strategies of dental caries, strategies used to prevent periodontal disease, various strategies used to prevent malocclusion, orofacial trauma, as well as oral cancer. Now, next is, how do you provide a preventive service? Preventive services can be provided at various levels. It can be at the individual level, it can be at the community level, and it can be at the professional level. Okay, so what do you understand by preventive services rendered at different level? That means what exactly you mean? That means how you give a preventive service. Like for example, at the individual level, what do you mean by this individual level? Preventive measures rendered by the individual, him or herself, for him or herself. That means it is basically a self-care. Okay, how an individual takes care of his oral health himself. That is called as individual level of preventive service, like maintaining a good dietary habit, maintaining good oral hygiene practices by himself. He periodically inspects that any abnormality is there, any blackish discoloration is there, so that he reports himself. He maintains a periodic recall with the patient, with the dentist. He himself applies fluoride, self-applied fluoride. Like for example, you're using a fluoridated toothpaste regularly. Okay, maintaining his oral hygiene in a proper way and doing a periodic dental visit regularly. It is his responsibility. This is called as providing preventive services at individual level. Next is providing in preventive services at community level. What do you mean by this community level? That means here preventive measures are rendered at community level by leaders or dental health professionals for a community as a whole. Like for example, our university often conducts community camps every year. Okay, so they conduct where in the rural areas. So in that camp, in that what they do is that it's a community program. Okay, community outreach program. What they do is that the university conducts a health community service campaign in the rural areas where all the colleges from our university will come, like College of Medicine, College of Dentistry, Applied Sciences. Everybody participates. The camp will be conducted in the rural area. Even the interns, the students also participate there. So basically what happens there is you create a health awareness for the patient there, okay, in the rural areas, give them reference to come to the college if they have any issues, so that what happens is they get an idea about the importance of the oral health as well as the general health. So community oral health campaigns like includes health education, it includes water fluoridation, school oral health programs. You visit their schools, okay, as I had mentioned earlier, when you come to level 11, you visit schools. Okay, you do various preventive procedures. These all are community level. Community level means to a larger public, larger people, you do a preventive program. It includes even school water fluoridation as well as sealant programs. These are considered to be very effective and very essential because it creates an awareness for people to maintain their oral hygiene in a better way. This is about the providing preventive services at a community level. Now, providing preventive services at a professional level. What do you mean by professional level? That means what preventive services you give at your dental clinic, in your dental clinic. That is called as professional level. As a what preventive procedures, what preventive protocols you give for the patient when he comes to your clinic. This is professional level of rendering preventive services. This includes health education, diet counseling. Diet counseling is a very important aspect. Diet counseling means what? You tell the patient what to eat, what not to eat, what is good for the patient's teeth, what is not good for the patient's teeth, and when it should be taken. This is all about diet counseling, whether it is for a child or for an adult. Topical fluid applications. I told you earlier, topical fluid applications. It is available in the form of APF gel. It is available, that is fluoride gel. It is available as fluoride varnish. It is also available as fluoride mouth rinse. But fluoride mouth rinse is not an office program. It is taken by the individual at home. But fluoride gel and fluoride varnish are given by the dentist in the dental office. Okay, this contain high level of fluoride, so this has to be given only by the dentist. They should not take themselves. Apart from that, Pitt and Fisher sealants and preventive resin restorations I had mentioned earlier. These are Pitt and Fisher sealants, especially in the molars. They have deep pits and fissures. Whatever the patient eats, it gets lodged here and it attracts bacteria and can lead to caries. To prevent the food lodgement, what you do is you give a cement-like material, okay, resin-like material. Resin-like material is flowed around the tooth and it is light cured, so that what happens is whatever the patient eats does not lodge in the pit and fissures. so that the Pitton-Fisher caries does not occur. Apart from that, other preventive procedures that can be done is restorations that comes under secondary prevention, root canal treatment, surgical intervention, and prosthetic rehabilitation. All these three comes under tertiary prevention. But in the dental office, you can provide a primary prevention, you can provide a secondary prevention, you can provide a tertiary prevention. All forms of prevention can be done only in the dental office setup at the professional level. This is all about today's lecture. Ultimately, to conclude, it is always known a fact that prevention is always better than cure. So now, for example, before any disease occurs, if you prevent yourself, you not only protect you, but also the entire society. Like for in case of a coronavirus pandemic, if there is giving vaccine, if it is safe, we have to take it so that you protect yourself and everyone. So prevention is always better than cure. That's all for today's lecture. Thank you. Any doubts? How many questions in each quiz? There will be 10 questions in each quiz for 10 marks. Midterm, you will be having 20 questions, 20 marks. Final theory,